Well, September is Prostate Cancer Awareness Month, and this comes as a new study on different treatment options was just released. Researchers found there is no difference in the survival rate of men who choose to get treatment like surgery over those who choose to monitor. Joining me now is Dr. Andrew Lee, Medical Director of the Texas Center Proton Therapy. Dr. Lee, thanks for joining us.
My pleasure. I'm happy to be here.
Interesting study. What's your take on it, and does it reflect the treatment options that are out there right now?
Yes, I think it is a reasonable approximation for what treatment options are available for men presenting with very early prostate cancer, and that has to be kept in mind. The patients enrolled on this study were probably presenting with prostate cancer at the various early stages. And we have to keep in mind that the randomization, there were 3 different treatment arms. You could either have surgery, you could have radiation therapy, or you could have active monitoring with the opportunity for delayed treatment. So that third group, actually over half those patients ended up receiving some radical therapy at some point in their 10-year span.
This is interesting. It essentially looked at men in early stages of the cancer, and those who chose surgery had the same outcome as those who chose not to do something like surgery. What do you think is the most important thing that men should take away from this new study's findings?
Well, the first thing is I think those men that opt to actually definitively treat their prostate cancer at an early stage can be rest assured that their survival and the incidence of having distant metastatic disease over a 10-year span is quite low. Now, those same patients that may choose to actively monitor their cancer, they may also enjoy reasonable survival at a 10-year benchmark, but it doesn't mean they can ignore their prostate cancer. They still need to actively go to the doctor and have their labs checked periodically and to be monitoring the progress of their cancer because they may need therapy within the first 3 years, for example.
And doctor, this by no means means that men should just go ahead and skip the screenings. Talk to me about the importance of screenings, how it's done, how often it should be done, things like that.
Well, I think in general, it's a conversation that needs to be had with your primary care physician, and in general, one recommendation would be starting at age 50. It should be a conversation you have. Now, the caveats are if you have any first-degree relatives, such as a father, a brother, or even a son that had prostate cancer, you probably should start getting screened in your mid-40s, and the same might be true for men that are African American. And that's an interesting point. The study that came out of the UK regarding these different treatment options, about 99% of those patients were actually white. So we don't know how those data are going to relate to the general population in an area like DFW.
All right, Dr. Andrew Lee, thank you for your insight this afternoon. We appreciate it.
My pleasure.